Okay, so we've been live and now we're going to podcast, but it's short and sweet today because in many ways we're kind of out of kilter, James. It's usually the first Wednesday that you're here, but it's the third Wednesday as we move in towards Christmas. Anyway, some more questions to do. Had shingles around my eye and forehead about 8 weeks ago, but had nerve damage and left with annoying itch. Any remedy and relief, please?
Well, Ger, as we've often spoken about shingles before, ultimately what we're looking at here is a viral infection of the nerve, which can cause really pain, uncomfort, discomfort, and a lot of upset for people. I've seen it especially around the eye and forehead area, even around the back. Now, the most important here is nerve damage, Ger.
Yeah.
And how do we actually heal that? So there are products out there, Famvir and Acyclovir, which are very good at, say, stopping the virus, killing it and moving it on. But how do we heal that damage? And a lot of people, we forget about that. So ultimately you end up with this thing called post-herpetic pain.
Yes.
So what we try and do, and what we have found, is that the myelin sheath, which covers, if you look at a cable, Ger, and just on the outside, the plastic on the outside the cable, that's like the myelin sheath on your nerve lining. If you can get some omega-3 and vitamin B complex and go on that for a good period of time, 2 to 3 months, it will have a massive improvement on the myelin sheath. And it will improve that the body's capability to deal with that post-herpetic pain.
Well, that's good to hear.
For that person, it's really important to help with that relief. You can get pain relief, as in get pain tablets, but at the underlying issue, the underlying cause, which is the myelin sheath, omega-3 and vitamin B complex, extremely effective.
Good man. James, can you please repeat the oil that you mentioned for thinning hair, the name of it?
The one that I recommend, say, for your standard person coming in, Ger, who's looking at that, is rosemary oil. Now, we would have, with patients going on chemo or going through that are on chemotherapeutic medicines that can actually cause hair loss. Mm-hmm. There's a special oils that we would make up ourselves specifically for that. But that needs a sit down and a consultation with the patient. So, but the one that, you're coming in and you're asking questions, rosemary oil.
Rosemary oil. Yeah. Listener bought 2 ointments in the pharmacy for his skin, Ovel emulsifying ointment and Ovel Silcox base. Does James know anything about them? Are they good and what are they used for?
Yeah, well, usually the skin, if the skin is drying out, Ger, and if you're getting irritation or anything like that, what I'd always recommend is to use the Silcox base as a kind of like a shower printer.
Okay,
so you go in and use the Silcox base to use it as a shower gel, and you can massage your skin, and basically you can see it actually hydrating. Now, the emulsifying ointment, my only thing is with the emulsifying ointment, it can be quite difficult to get out of the tin. So what I say is, if you can just leave it at room temperature,
right?
Yeah,
because it solidifies.
It can, yeah. So on that basis, what I would recommend is just to leave it at room temperature and not to use too much of it. So if they have a specific area where there's really bad dryness or whatever, that's where you use the emulsifying ointment. But use the Silcox base as a natural emollient, as a natural wash, and it really helps the skin to rehydrate.
Perfect. James, have you any remedy for hooded eyes in the 60s age group I am? What's hooded eyes? James?
Hooded eyes, I think it's where the flap of skin descends, Ger. And I know there are people out there, I know there are specialist surgeons who actually deal with that type of thing. Yeah. So it's a conversation with your GP, but I do know that there are aesthetic surgeons
plastic surgery
who can deal with that, and they'd be the best person to talk to about
okay.
that. But it can be dealt with.
Okay. Now, can you ask James, what's the protocol for an enlarged gallbladder?
Well, sometimes with enlarged gallbladders, they can cause a sense of irritation, Ger, and it's all down to what you're eating in your diet. Yeah. So in circumstances like that, I always recommend to try and avoid over oily foods. Say for example, heavy fries or anything like that, Ger, and too much greens in the diet, because that can cause an irritation as well. So just be careful about eating too much greens and ease down on over oily or heavy fries, for example, fried eggs, fried sausages, stuff like that. Just be careful, and it's about manipulating the diet, and it should have a big improvement. What I would suggest there is if they just got something called liver blend, the benefits liver blend, 1 or 2 capsules a day for 2 or 3 months, that can really help just promote a cleansing effect in the whole body, and it also has a good impact on the gallbladder as well.
Perfect. And James, do you have any cure for tapeworms? I have this disease for the last 4 years. My doctor seems to think I'm imagining this, but I do feel nauseous all the time.
Well, there are medicines out there, Ger, and obviously if the doctor has been involved, obviously there would have been a treatment for it. The nausea, again, the doctor would have reviewed that. I think it would be important that if that person has a chance or whatever, if they could just maybe give us a call, 096600072, and I'll give them a call and have a chat with that, because I wouldn't mind just investigating that a little further. And
you
just
want to know more.
Yeah, I'd want to know more. I want to know what the doctor would have given. Want to know how they're feeling. Are they eating? When is the most time? Are they getting nausea all the time? Are they feeling really, really sick? Is it morning time, night time? And we'll be able to make a better diagnosis there, maybe help them a little bit more.
Finally, before I let you go, we seem to be thick into the flu season. So there's two questions.
Yes, sir.
Number one, is it too late for vaccination, James? And number two, what would be your general tips as we move in towards Christmas?
Well, my view on it is vaccinations are very, very good, Ger.
So it's not late.
I got vaccinated, and I'm the world's worst now at times. I'd be telling everybody else,
I know.
Vaccinate, and I forget myself. But one of my wonderful colleagues vaccinated me there a couple of months ago, and I found it very, very good. And that's not saying that I was predisposed. I got a bad cough, but it didn't stop me from doing my bits and pieces.
Yeah.
I had some propolis there for that, which I found very, very good. In general, what I would suggest is, number one, keep warm, hydration, making sure you're taking your electrolytes every day. If you do come down or do succumb to a bad flu, my view on it is something like Ilvaco and the propolis cough bottle are as good as any, because they keep the symptoms under control. Make sure that if you're on any medication or if you're immunocompromised or whatever, you need to make sure your GP is aware of it.
Good man. Well, you've said it all now. So, James, again, thanks for your company. God bless. Have a happy Christmas.
Thank you,
we
Ger.
said, of course, all available on your website, which is Malloy's Pharmacy.
Yep. www.malloyspharmacy.com there. Sorry about that.
No problem. And 096 60072. And of course, on the website, you'll find those extra opening hours into, over and through Christmas. James, thanks indeed. Take care.
Great. Thank you for everything, Ger.